I qualified in South Africa with the College of Medicine, qualified in 1989 as a radiation oncologist. I must say that in those days, we were much closer to a clinical oncologist than a radiation oncologist. And I came to New Zealand in 1997 to work in Wellington Hospital. At that time, there were just 3 radiation oncologists and 1 medical oncologist. Things, as you know, have changed a lot since those days. I started with my involvement with the college in 2006. And I've sat in a number of volunteering roles within the college. I have been on the New Zealand executive. I have been with the what was the board, and then became the council as a councillor. I have been involved as the chair of one of the SIG groups, GOROC. And the most recent position has been as Chief of Professional Practice, which put me back onto the FRO Council as well. What is involved in these is a lot of reading, a lot of meetings, but they're not intimidating. There have been a number of face-to-face meetings, but more recently there's a better balance between face-to-face meetings and more team meetings. But you have an opportunity to meet people who are also keen and interested in making things better and getting to the heart of how the college works and how to make things change if they need to be changed. The first college ASM I went to, I attended the AGM as well. And sitting in the audience there, trying to participate, I was quite frustrated as an educational affiliate that I didn't have a vote. I didn't have a voice. And I thought, this is my peak body that is here to represent my profession, my future, my career. And my college back in South Africa would have zero relevance. And I wanted to get involved with a body that would most protect my future. And so I decided that I would put my hat in the ring and got involved that way as a New Zealand representative. At the time, we had very limited opportunities in New Zealand to talk together as radiation oncologists to advance our professional position. And I was one of the founding members who put together the New Zealand executive, which was separate from the New Zealand branch, because this was really just for the radiation oncologists and allowed us to gather a New Zealand perspective. And certainly when I was appointed to what would now be called the council, I was doing it there primarily to make sure the New Zealand voice was heard. Our practice in New Zealand is quite different in terms of the governance, the workforce, funding, those kind of issues, not how you treat patients, but very much around the governance in the future, predominantly public service rather than a mixture of private and public. And so that was my main contribution at the time. I also then became a full fellow through what I'm going to say is the back door, which was very fortunate, because then I'm in a position to be a full fellow with the college now, and it allows me to have a very loud say should I wish to. And I must say I have often spoken out over issues as time has gone by. One of my opportunities in life was to represent radiation oncology in various advisory groups to the ministry in New Zealand. And so by sitting both at the table for the college and also for the round Ministry of Health advisory groups, I was in a unique position to be able to find out how the workings worked in both places and know which buttons to push, what to speak to, where the problems were. And so there was a lot of synergy in advancing our profession, our concerns, knowing how to get things trying to get things over the line. So it benefited not just our profession. I believe it also has helped the New Zealand health sector to know where our issues have been. Not that they've always listened and always responded, but they certainly have been told and informed where the roadblocks are, where the concerns were. And so they have known, and that was an opportunity to work both for the college as well as with the public sector in New Zealand. Certainly, I'm very keen that we maintain a profile of being a professional organisation. Who else is better to do it than us? We've got the most skin in the game, and so I've really wanted us to maintain our head up and not be considered as just uh, people doers in terms of just delivering treatment. We needed to be considered as oncologists alongside our other medical oncology colleagues. My other area of passion, for those who know me, is very much in the realm of brachytherapy, particularly for gynae cancer treatment. So I've spent quite a lot of time invested in that and trying to maintain it as a skill that we have, that we can keep at the top level of skills in New Zealand and Australia. Stop thinking about it and just do it. Dive in. If you're even thinking that maybe you should, don't worry about whether you won't be supported, because you will be supported. You are going to meet uh, a whole world of other people who are there to support you, to encourage you. You'll be inspired by them. You'll learn so much about how things work. You'll appreciate why things sometimes take longer than you might think. But I believe you will be better off for it. And you will, I don't know anybody who has had regrets about engaging with the college. You will meet some very, very passionate and inspiring people as a consequence, and you'll be better for it.